Right. Okay, there we go. So I'm here to present on access, opportunity, and advancement. And so for me, what we're going to talk about in regards to the objectives is to be able to identify the social determinants of health that impact adolescents. I know we had a session on that earlier, but when we talk about access, opportunity, and advancement, you can't discuss those three items without talking about the social and even political determinants of health. We will also identify points of access to address adolescent health and the opportunities to advance the same. And so for me, I serve as the Chief Diversity Officer at the Arkansas Colleges of Health Education. It is a private nonprofit medical school located in Fort Smith, Arkansas. And so I was privileged to be asked by Victoria to come and present. And so thank you, Victoria, for the invitation, to you and Jennifer and you all's team for just being great hosts. And so thank you to everyone that have been here in attendance as well. So as we go forward, let's talk about adolescence for a moment. I know last night we spoke about the different aspects of lifestyles and trends that were popular when we were adolescents. And in that you can see some of the generational differences. But what do we know? Once something has gone through one generation, it tends to repeat itself. And so we're seeing a lot of those being repeated right now. But as we talk about adolescence, we know that it's a time of significant developmental transition. Adolescents, they set the stage for adult health through risks taken and various beneficial and detrimental habits that are formed at this very age. And so when we talk about these particular habits, we talk about these aspects of lifestyles. What we mean, we talk about sex, we talk about smoking, whether that's cigarettes, whether that's vaping, whether that's marijuana, and even earlier with Dr. Mincy's presentation, cocaine. Never even would have thought as adolescents experimenting with hard substances such as that. And so those are things that we have to be mindful of. But with adolescents, we know that it's even more prevalent when you have low income communities that are being dealt the blows that adolescents are going through. All right, now, as we talk about, as stated, the social determinants of health, the ones that we will highlight, which are defined by the World Health Organization, which are the conditions in which people are born, grow, live, work, and age. And so what we talk about, what we mean is we talk about educational access and quality. We talk about healthcare and quality. We talk about the neighborhood and built environments. We talk about social and community context, as well as economic stability. These 5 components are what affect and impact, whether positively or negatively, various communities, but more so adolescents. And so as we talk about educational access, we talk about that adults with low educational attainment tend to experience a higher level of health inequalities. With that, children and adolescents living in those households and those environments have to deal with those same inequalities as well. And in regards to that, those inequalities in health and mortality rates, they increase steadily to a point where we now see an unprecedented pattern of health and longevity are deteriorating among those specific communities. In regards to the educational piece, we want to look at, in theory, the fundamental cause theory, which pretty much says that social factors such as education are fundamental causes of health and disease because they determine access to a multitude of material and non-material resources, such as income, safe neighborhoods, or healthier lifestyles, all of which protect or enhance health. Now, some of us that have grown up, I grew up in Southwest Arkansas. For dinner, sometimes we would do pork and beans and cornbread muffins. Now, when we wanted to get fancy, we would cut up some hot dogs and put it in there. And if you really want to add a little razzle dazzle, you put some honey in there. So back then, we didn't know. We thought we were living a good life. But as you look at the ingredients and the nutritional factors in regards to that, you know, that's a lot of sodium. That's a lot of processed meats and foods that we're ingesting. But it was cooked with love, so we're not going to go against what mama put in front of us. But as we get older, you look at more aspects and things that we need to do and focus on in regards to eating more healthy. So as we go forward, we're talking about the healthcare quality, which although the average age of the US population has improved over the past few decades, or average health rather, the gains largely went to the more educated and affluent groups because they have access. Those young people have more access due to their parents to those services, to those foods, to those stores and neighborhoods that will help benefit their health more so overall. Now, this determinant really hits home and really helps me just kind of get into the psyche of who I am as a person. We talk about the neighborhood and built environment. So there are two components to this. Social environment is pretty much the social economic composition of the residential population and social aspects of neighborhood. So we talk about crime, community support, social capital, even forms of disorder, whether it's presence of trash, graffiti, or disorderly conduct in various activities that go about in certain communities. The second component, the built environment, comprises of the man-made physical attributes of that surrounding, including those that are affected by walkability or recreation, as well as other health promoting resources. So for instance, grocery stores and playgrounds. Now, when we look at this, we look at these particular neighborhoods and we talk about access to health. When you look at neighborhoods such as this that is pictured, do you think there will be a Whole Foods located around the corner? Not even there. Two of the things that are there more so are food deserts, which are areas that have limited access to affordable and nutritious food, but also food swamps, areas that will sure enough have, guess what? McDonald's, Popeyes, liquor store, KFC, and probably about 12 churches as well. But that's the neighborhoods that you see where in regards to access to those nutritional foods and resources, they're not there. And so as a result, one book that I encourage you all to read, because when we talk about these neighborhoods, the substandard housing conditions which affect the respiratory system of individuals, whether it's caused by lead poisoning or other factors that contribute to mental health illnesses, these same buildings and household complexes may have water damage, which leads to mold, and students, young people breathing that in. If it's not treated early on, guess what? It will grow. And as time, their health will be deteriorated by the time they're old enough to know I can go to the physician and be checked out. Some of the other aspects in regards to this, in these particular neighborhoods, you see there's stress, there's depression, anxiety, all coupled with the pressures at home. But now that we've seen over the years, but have grown in the past 2 to 3 years, police brutality. Last night, we had a very robust panel discussion where we talked about the murder of the rap artist Takeoff, and how the trauma with that, where young people on social media and news outlets are retweeting or reposting the body, the victim's body just laying there. That's trauma. All those things cycled and stacked on top of what these young people in these various communities have been experiencing over time will not do anything or be beneficial to them at all. But the book that I was making reference to is The Color of Law by Richard Rothstein. By show of hands, have anyone heard of the book or read the book, The Color of Law? All right, I have one member in the congregation who has done so. But if you have time, it's about maybe 250-page book. read it at your leisure, but it focuses on the government's deliberately imposed racial segregation of metropolitan areas nationwide. From the conclusion of the Civil War through probably present day, it focuses on the federal, state, and local governments having enacted laws to confine African Americans to particular areas and prevent them from moving to others. And so those same neighborhoods where there used to be industrial businesses and different corporations and things of that nature, a lot of those grounds and a lot of those areas are filled with pollution. The grounds are contaminated. A lot of rundown buildings and things of that nature. But because of those laws that were enacted years ago, still effective, or the effects are still present now, you see these neighborhoods just like this that is pictured, The Color of Law. If you have time, I promise you will not be disappointed in that book. You may be a little upset, maybe even angry, but that's human emotion. That's a natural reaction, but it's very informative and it's very eye-opening. Now, as we talk about the social and community context in regards to this, we focus on an adolescent's relationship and interaction with family, friends, and community members can have a major impact on the health and well-being. We know this. As many young people as possible can interact with someone who is positive, who is breathing life into them, who is not looking to tear them down, who is not looking to judge or stereotype them, those positive relationships can be impactful. As we discuss this, these positive relationships at home, at work, and in the community can help reduce these negative impacts. And so there are some instances where if you talk with a young person who, as they claim, have made it, ask them, was there someone who was impactful in your life? And they will say yes, whether it's a parent, whether it's a coach, whether it's a pastor or youth leader, someone took time out to invest in them. And so that seems to be all the more important. But according to health.gov, adolescents who have had an adult to confide in them are less likely to take part in risky behaviors. And so I know I am the uncle of 3 teenage girls, 15, 14, and 14. I take that back, 16, 14, and 14, and just found out the 16-year-old has a boyfriend. So you know me, I had those questions. What grade are you in? I'm a senior. Like, she's a sophomore, okay. What do you want to do after you graduate high school? I want to go to college. What's your ACT or SAT scores? He told me the scores. What do you want to do with that? I want to study agricultural science. Okay, what's next? I want to get a farm and I want to marry your niece. I said, slow down. I appreciate that, but I want my baby girl to at least get a master's degree, and then we can talk about you taking her on a date or something. But those interactions, I ain't even talking about prom, I'm just a date. But with those interactions, it's important to be able to have someone, because knowing my niece, knowing her mom, my sister, there's not going to be much confiding from her. Though I want her to have someone to, hey, Unc, look, I like this young man. I don't have to like him, but as long as he respects you and you keep your grades up, I'm fine with that. So it's important, not only when we talk about the uncle-niece dynamic, or even if you're a parent or you're involved in other community engaging events with young people, be that support system for them, because it can make the world of difference. And lastly, I will touch on the economic stability aspect. So according to 2019 US Census, 1 in 10 Americans live in poverty, and many people can't afford things such as healthy foods, healthcare, and housing. Who would have known that healthy food costs so much? As stated, I am a native Arkansan, so I wanted to pull the data from the U.S. Bureau of Labor Statistics 2021 of the unemployment rate for the state of Georgia, and which is 4%. But then the orange is the state of Georgia in the Black and Hispanic communities, which is 8.5. In Arkansas, the brown, we're a little north of you all, 4.1. And hey, we've got to beat you in something, right? The blue, Black and Hispanic unemployment rate is 10.2 in the state of Arkansas. So when you talk about this, that people with steady employment are less likely to live in poverty and more likely to be healthy, but many folks having trouble finding and keeping a job, and it pours more into folks with disabilities, injuries, or conditions, may not be able to, may have a limited aspect of ability when it comes to working. And so in addition, many people with steady work still don't earn enough to afford the things they need to stay healthy. Who would have known? And so as we discuss access, the National Academies of Sciences, Engineering, and Medicine, formerly known as the Institute of Medicine, defines access to healthcare as the timely use of personal health services to achieve the best possible health outcomes. Timely, folks, timely. So that means if a young person becomes pregnant, or if they contract an STI or STD, or if they're having respiratory issues, the timely aspect of getting access to healthcare is so important. That's what we mean when we discuss the terms access. And so some of the benefits in regards to adolescents accessing care is that it modifies and deters risky behaviors, including self-harm and suicide. It encourages healthy habits, promotes social connectedness, support, and overall health. And so, since the implementation of the Affordable Care Act in 2010, researchers report that young adults have increased their use of preventative services via wellness visits, 28% pre-ACA to 32% post-ACA. And this is measured across most racial and ethnic groups. But despite this improvement, less than half of all US adolescents receive wellness visits, which is the key to prevention. If we can get them into those wellness visits to meet with those physicians, hopefully that look like them, and understand, as Dr. Cromwell focused on the cultural humility and competence, being able to, if you don't look like that person, you at least understand them, then you can help address those issues that those individuals may have. And so as we talk about access, there always is some form of a barrier. And so some of these that we will look at are individual levels of the barriers of access, interpersonal, organizational, which organizational focuses more on institutions or health organizations dealing with drug shortages, limited clinical space, lack of organizational regard for the barriers to care for youth, and poor coordination of care when you talk about addressing these issues within the communities. And so there are also community level as well as policy level factors when we talk about the barriers to access. And so with community, this focuses more on the primary barriers identified in regards to the stigma of seeking care. How many of us now or even growing up dealt with, I'm not going to the doctor, I'm okay. We don't have the money for that. For me growing up, once again, I told you about the dinner, right? The pork and beans with the hot dogs and the cornbread. For us, if you were sick with a cold, you took Robitussin. That's it. If you were severely sick, Jennifer, we want to get fancy, we take Theraflu. Now, if you were even more sick than that, now say it in the South, oh, we going to pray. I could count on possibly one hand that growing up actually went to the doctor. Actually, never. Since being born, yes, doing your baby checkups and all that. But ever since then, unless it's the dentist or the eye doctor, blessed, knock on wood. But outside of that, the stigmas and aspects of thinking, we're not going to the doctor. Nothing's wrong with you. Whereas you look at some individuals are more than eager to go all the time. But as we kind of discuss these various barriers, and I definitely want to be mindful of time, because as a son of a Baptist preacher, I understand and realize that when be mindful of the time you're allotted, but then B, never standing between folks and A, getting the food, or B, going home. So I want to give you the good stuff, and then there can be further conversations afterwards. So I really want to be mindful of this. But as we look at some of these opportunities in regards to advancing healthcare for adolescents, positive connections with supportive people, we talked about that, having those safe and stable and nurturing environments and relationships for young people is so important. Also, safe and secure places to live, learn, and play. A lot of times growing up, you would have young folks, especially my peers, who would get in trouble because they just were hanging out on the corner. Some may have been doing something they weren't supposed to. Others were just there for the company. However, having establishments and groups and organizations for young people to productively hang out is all the more better. And I know that you all have that here in the state of Georgia. Also, access to high quality and teen-friendly healthcare is all the more important. Opportunities for these young people to engage as learners, leaders, team members, and workers. So when we talk about different organizations and different groups for these young people to develop these leadership skills, is so important. You don't know who you will come across. You may come across a future elected official. You may come across someone who may be interested in law enforcement or interested in being a small business owner. Always ensuring that you're taking the time out to engage these young people and plant those seeds of hope and love in them. And lastly, coordinated adolescent and family-centered services as needed. And so a lot of times there are some parents and families who aren't able to take their child to maybe a game or have outings with them, because if they're in some low-income neighborhoods, they have to work 1, 2, maybe even 3 jobs. So sometimes the video game has to babysit, or the television. For me growing up, I don't know about you all, we had 3 channels, 3, 6, 9, 33. So it was ABC, NBC, CBS, and Fox. That was it. And so for us, those are some of the things that we had, but we didn't really have individuals that we could really look up to help us understand more of what it is to be healthy, to be engaged, and to be focused on that. And so one of the things, talking about advancement, I'm mindful of the time, investing in the healthcare of adolescents, ensuring attitudes of providers are welcoming to all patients. When we talk about diversity, equity, inclusion, that inclusion piece is so important. The last one, hold elected officials accountable regarding adolescent health issues. So important. In Arkansas, we have this big campaign focusing on opioid addiction amongst young people. It really came about when the elected officials, a friend of theirs' child overdosed on opioids. But when it happened to, right. So holding them accountable, saying, well, let's lay this blanket on everybody then and provide services and care for them all. In regards to organizational change, it's just all about being mindful of how we can address the issues at hand. whether it is a knowledge gap, meaning you have the resources and you want to do it, don't know how to. Same for motivation, you have the knowledge and the resources, just don't want to do it, or you have the knowledge, you're motivated, but you don't have the resources to get it done. So working with the local and state agencies to get the job done is so important. And lastly, the call to action, saving and serving our youth is a task that requires a village. Utilize the available resources on the local, state, and national level to continue changing the landscape of healthcare for adolescents. Ladies and gentlemen, continue doing the good work. It gets long, it gets tiresome, but it is needed. And so we need everyone here to continue to be advocates and to be true champions for adolescent health and well-being. These are my references, and any questions? Thank you all so much. You've been great.